Hi, my name is Jimena Loveluck, and I'm the Health Officer for the Washtenaw County Health Department. Welcome back to another COVID-19 video update. Today, we're filming from our Health Department October drive-through vaccine clinic at 555 Towner in Ypsilanti. Washtenaw County is still at a high level of community transmission. Because of this, we continue to strongly recommend that everyone wear masks in indoor public spaces. We also urge everyone eligible to get vaccinated if they haven't already. With the Delta variant circulating and our high number of local cases, our contact tracers don't have the capacity to notify close contacts of every positive case. This makes it even more important to follow isolation guidance if you test positive and to follow quarantine guidance if you've been exposed. If you're having symptoms of COVID-19, avoid others and get tested. Our effective public health tools like masks, vaccines, isolation and quarantine protocols, testing, good ventilation, distancing, and hand washing will help us slow the spread and prevent COVID-19 from harming more people in our community. At the same time, we're getting into flu season. The best way to protect yourself from the flu is to get your flu shot. Everyone 6 months and older needs a flu vaccine each year. Ideally, everyone should be vaccinated by the end of October because your body takes about 2 weeks to develop antibodies that protect against flu. Like COVID-19 vaccines, flu vaccines work to prevent serious illness, hospitalization, and death. They're especially important for seniors, pregnant people, young children, and people with chronic health problems. Flu vaccines are widely available from healthcare providers and pharmacies. We encourage you to make a plan to get yours today. COVID-19 vaccine booster doses are now recommended for some people who got the Pfizer vaccine. Booster doses are common for many vaccines. The new guidance for Pfizer boosters is a reminder that as the science and virus evolves, so do our policies and recommendations. We continue to see highly effective protection against severe illness and hospitalization for people who are fully vaccinated. These recommendations do not mean that the vaccines are not working. It just means that those most vulnerable to COVID-19 can get an extra boost of protection after time has passed from their initial vaccine series. The CDC recommends a Pfizer booster dose for adults 65 and older, those living in long-term care facilities, adults 50 to 64 who are at high risk of severe COVID-19 due to underlying medical conditions, and adults 18 to 64 who have jobs that put them at high risk for COVID-19. That last group includes first responders, education staff, including teachers and daycare workers, postal service workers, and those who work in food and agriculture, manufacturing, corrections, public transit, or grocery stores. Additionally, adults ages 18 to 49 who are at high risk of severe COVID-19 due to underlying medical conditions should consider getting a booster based on their individual situation and in consultation with their healthcare provider. These boosters can be given 6 months after a second Pfizer dose. Those who got Moderna or Johnson & Johnson vaccines are not eligible for a booster at this time. Experts are still reviewing data about boosters for these vaccines. Please be assured that all 3 vaccines are still effective and safe. As always, we will share more information when we have it. While booster shots help people more vulnerable to COVID-19 develop additional antibodies after 6 months has passed from their second dose, additional doses for immunocompromised people have a different purpose. Additional doses are for people who were likely unable to build enough protection after their initial vaccine series due to underlying medical conditions. Additional doses are recommended for moderately to severely immunocompromised people who received Pfizer or Moderna, and they can be given 28 days after a second dose. We strongly encourage patients to talk with their primary care doctor or treatment team before getting an additional dose. Your healthcare provider can help determine if an additional shot is needed and, importantly, determine the appropriate timing of an additional dose. If you get a booster or additional dose, remember to bring your vaccine card with you. You can go to any vaccine provider that is convenient for you. You don't need to go back to where you got your original doses. We have vaccine clinics open for anyone who needs their initial vaccine, booster dose, or additional dose. For the month of October, we have a drive-through clinic open at our health department office at 555 Towner in Ypsilanti. The drive-through is open Tuesday through Friday from 9 a.m. to 3:30 p.m. It is also open from 10 a.m. to 3 p.m. on Saturday, October 16th and Saturday, October 23rd. In addition to this drive-through, we continue to host a regular walk-in clinic as well as pop-up clinics. Our website remains the best place for up-to-date information on vaccine clinic locations and hours. Anyone can also call us at 734-544-6700 to get connected to vaccine resources. Many pharmacies and local healthcare providers are also able to give vaccines. We're continuing to work closely with schools to monitor data and prevent the spread of COVID-19 in educational settings. Our 2 local health orders regarding masks and isolation and quarantine in pre-K through 12th grade educational settings remain in effect. Preliminary data from MDHHS and new reports from the CDC reinforce the importance of practicing layered prevention strategies to keep schools safe and open for in-person learning. We're also hopeful that the Pfizer vaccine will soon be available for kids ages 5 to 11. Pfizer has released details of their clinical trials showing that its COVID-19 vaccine is safe and effective for children in this age group. The FDA is currently reviewing this evidence. Before vaccines are available to kids, they will have to be authorized by the FDA and recommended by the CDC, which could still take a couple of weeks. Authorization for younger kids will allow even more people the opportunity to gain safe COVID-19 immunity from vaccines. We're already planning vaccine clinics for this age group in partnership with our local schools so we can start providing vaccines to kids as soon as possible. If you're a parent or guardian, now is a good time to get answers to any questions you may have about COVID-19 vaccines for kids. We encourage you to talk to your child's healthcare provider for more information. As of October 5th, nearly 90% of residents 65 and older and almost 65% of residents 12 to 64 have completed a full vaccine series. Just over 60% of all Washtenaw County residents have been fully vaccinated. The most up-to-date COVID-19 information is always available on our website, social media channels, and email updates. Thank you for watching, and we hope you have a safe fall season.